Hi everyone, I'm Kim Saruwatari, Director of Public Health for Riverside County, and I know that many of you have questions about the vaccine, the COVID-19 vaccine, as we roll it out. And so we're taking a few minutes today to hopefully answer a lot of the questions that are out there. So right now we're in the process of vaccinating everybody that's listed in Phase 1A. If you go to our website, ruhealth.org, you can click on the COVID vaccine icon and you can see who's included in Phase 1A. So it's all of our frontline healthcare workers, so people who work in general acute care hospitals, people who work in our skilled nursing facilities and long-term care facilities, dialysis centers, primary care practitioners, urgent cares, community health centers, also folks who work out in the fields as community health workers or promotoras, our folks that are in-home supportive services caregivers. Also people who work in mortuaries, they're also eligible for vaccine in this phase. And so all of those people that really are frontline personnel taking care of people are encouraged to get vaccinated. And again, if you go to our website, we have a complete list there. So because we know this is a new vaccine for a novel virus or a new virus we haven't seen before, we are getting vaccine in allocations. There isn't enough made right now at this very moment to vaccinate everybody in the country. So as vaccine is made by the manufacturers, it's being distributed out to states and local health departments so that we can get vaccinations out to providers and administer to people who are eligible for the vaccine. So it's all based on how much vaccine we have available, and that will determine how quickly we can move through those phases. My best guess at this point is that it will take us a few months to get through the phases, and the general public should have the ability to get vaccinated in late spring or early summer. So this vaccine is safe. It has gone through rigorous clinical trials with tens of thousands of people that have been included in both of the Pfizer and the Moderna vaccine. The data from the clinical trials has been reviewed by experts with the Food and Drug Administration, with the Advisory Committee on Immunization Practices, staff from the Centers for Disease Control and Prevention. All of them have looked at the data from the clinical trials and determined that this vaccine is safe for people. In addition to that, in California, we have an extra layer of safety because we have the Western States Scientific Review Committee. And so they are looking at the vaccine data also. So it's another set of eyes that have looked at the data, and they unanimously agreed that it is a safe vaccine to give to people. A healthy person absolutely should get vaccinated. So this vaccine is going to help prevent serious disease should a healthy person get exposed, or should anybody get exposed. And in order for us to have good protection throughout our community, we need as many people as possible to get vaccinated. There's this concept called herd immunity that we've all heard a lot about. In order to get to herd immunity, we need immunity in upwards of 75 to 80% of the population. We really need everybody to go out and get vaccinated when it is your turn, because you're doing it for yourself and you're doing it for your community. So hopefully I answered some of your pressing questions today. I encourage all of you to take a look at our website, ruhealth.org, and click on the COVID-19 vaccine icon. If you go to that website, you're gonna find a lot of information about the vaccine, as well as a schedule of when people are eligible to get the vaccine and where we're offering it in the community. So please visit our website and get your questions answered.